Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are going to be talking about the framework we use at Novera Headache Center to overcome, address, and provide a solution to nearly every type of headache and migraine. You see, this is a topic that I want to recirculate through this podcast every now and then. We're going to go through the three steps, the three spokes of our framework, which will address, one, the underlying source of pain, two, any factor that is going to be a barrier for you finding relief, and then three, the systemic side of the pain itself in the threshold that you might have and how we can interact and improve that. So three-spoke framework. We're going to go through each spoke of the framework. What you're going to leave this podcast with is a better understanding of the why behind your headaches and migraines, and then you're going to understand the triggers, your overall health, and the different factors that play into what you experience. Oftentimes with headaches and migraines, people, because the symptoms are so severe and there's so many different types of triggers, things that can impact the body situation leading to the symptoms, like we talked about on the last podcast. Because there's so many different triggers and those get confused with the underlying source of pain, we're going to talk about how both can be true. How can you have a trigger that impacts and leads to you experiencing your migraine symptoms, but that truly is just a trigger. It's not the cause. It's not the source. It's not necessarily even something that needs to be treated. It's just something that triggers that response. And so first off, let's talk about the underlying source of pain. Okay, so this is the first spoke in the framework. And by the way, this framework is something that is unique to us here at Novera Headache Center. It's a framework that has come about because, in large part, because of this podcast, the interviews that I've had with other providers, and the insights that I've gleaned from those providers, taking specialists in different fields, understanding how they're impacting the body and how they're seeing really, really positive results in the life of someone that has headaches or migraines, taking that information and then putting it into a framework, a model that blends with what we're doing so that we can now capture every type of headache and migraine and either treat them effectively with our process or know where to refer them to. All right, so the first spoke in the framework is understanding the underlying source of pain. So we want to get to the source of the problem itself. Now, when I say the source of pain, understand that it's not exclusive to pain. Any type of headache or migraine symptom that you present with, whether that's numbness and tingling, an aura, sensitivities to lights and sounds, maybe you have nausea and dizziness. We even have people that have ear fullness, ringing in the ears. Okay, so there's a whole slew of symptoms that you could be presenting with. And we want to find the source, the underlying source of those symptoms. Now, let's talk about pain in particular, but when I say pain, just know that I mean any of those symptoms that I just listed. Okay, so when we're trying to figure out the source of pain, let's look at pain as an alarm signal. Now, pain is a good thing in our body. Pain is a signal that obviously something's wrong. If we don't have a pain signal warning us that there's some sort of tissue damage that's happening, we don't limp, we don't step on a rock or a sharp object and lift our foot up. We let wounds continue to receive like an impact or brush up against things. We don't realize that we have a cut and it continues to grow and potentially get infected. So there's all these reasons why pain is a good thing. It's part of the healing process. It alerts our brain of the problem, and then we accommodate to it, allowing our body to go through the natural process of inflammation and healing. All right. So pain is a good thing. Now, pain on rare occasions can manifest from, I guess, the pain itself almost never, the pain itself almost never is going to manifest out of nothing. Okay. Off the top of my head, so there are a few conditions like chronic regional pain syndrome that do have an initial trigger, or there's something that leads to tissue irritation. So let's say you sprain your ankle. All right. So that's the initial inciting incident. That's the thing that causes inflammation. Your ankle's sprained. There's maybe some tearing of ligaments, something like that. That initial response of inflammation within the first week or so, and then the body healing and then recovering, repairing, getting back to a pain-free state again. Sometimes on very rare occasions that will linger, okay? And there's different reasons for that scenario to linger, and the pain itself almost becomes this feedback loop on itself. So the pain that you experience has less to do and almost nothing to do with the actual physical tissue of your ankle being injured, and is more so just on its own feedback loop. So there are times where we remove pain from an underlying source, but it's very rare. And so that's important to understand, because when someone has an alarm signal going off, a pain signal going off, we need to understand why. All right. And by and large, our healthcare system, because they haven't been able to find the objective thing that's causing these symptoms, have largely left people to believe that this is a spontaneous neurological event. Okay. So essentially, it's just chemicals in the brain that are going haywire for a period of time, causing you to have debilitating pain that presents on one side of the head, stabbing behind the eye, nausea, vomiting, light sensitivity, sound sensitivity. Okay, so what we're going to do is we're going to say, okay, instead of that scenario leading to medication or just no answer as to what is actually causing this, we're gonna keep asking the question why. We're gonna act like 3-year-olds and just ask why. All right. Now, what's helpful as a physical therapist is we are educated and trained on understanding how the body should move and understanding what happens when the body doesn't move. And the nice thing about our training and our specialty is that we deal a lot with pain. So we have an education on understanding the science behind pain, the neurology, the neuroscience behind pain, the physiology behind pain, and then ultimately what causes pain, which is typically the musculoskeletal system, okay? So think of back pain, shoulder pain, neck pain, knee pain. So all of these types of pain throughout the body, intuitively we think, okay, there's something wrong with the joint or the muscle or the ligament or something in that area, some tissue in that area is irritated. And if I can solve that underlying problem, the pain will go away. That's widely accepted. That's how physical therapy functions. That's how we have for decades and decades. And that's how we should apply that same thinking to a headache and a migraine. Okay, so finding the underlying source of pain when it comes to a headache or a migraine, what we need to understand is that pain is referred from the upper part of the neck to the head or the face. It travels through a pathway in the brainstem called the trigeminal cervical nucleus, and that nucleus actually receives information and interprets it. Well, it sends it to the brain, and the brain interprets it from the trigeminal nerve, which is in the face, okay? Basically, any sensation from the face, any input from the face is going to run through this nucleus. Any sensation from the back of the head, the top of the head is going to run through this nucleus. So you have this spot in the brainstem that's gathering all this info and then sending it to the brain, and the brain kind of interprets what's happening. Because of this overlap of the upper part of the neck, the face, the head, because of all of this information running through the same channel, we know that a signal to the brain, to the head or the face, you feeling pain in your head or your face, could very easily be a neck problem. Okay, it could also be a jaw issue. It could potentially be a shoulder issue as well. All three of these areas are fair game to refer pain to the head or the face. Now, depending on which area is the problem or the driver of the issue, and then if it's specific, if it's general, if it's lots of muscle tissue, if it's one joint, I have other podcasts that go into detail with that stuff, but the type of pain will tell us what exactly is happening. But the idea with this first spoke is taking this concept of asking the question why, understanding that there is an underlying source of these symptoms, and in that it's likely going to be in the neck, jaw, or shoulders. That is the first spoke in the framework. Now, that spoke is if we understand that there's a source and then we try to pair it with a provider, someone who can treat that, it is going to be a physical therapist. It's not as if you can just look up physical therapy on your phone near me and call them and they'll be able to understand and handle your specific situation. It can be challenging to find a physical therapist that's equipped to evaluate and treat this properly. That's why we at Novera Headache Center are specializing in this so we can solve this problem. But the idea is to resolve the underlying issues that are causing this pain signal through physical therapy, and then also just through general movement, restoring function of the body, things that you can do on your own. That's a lot of what we do in our virtual coaching program. Okay, so that's the first spoke. The second spoke is, okay, so we have someone, we understand what the underlying cause of their symptoms are. Let's say it's their neck, okay? Most people, they have a neck issue. Now, we think about what developmentally, like we have to ask the question, and we don't have to answer it, but it's helpful to ask the question, why does this person now present with this problem? A lot of people we see are not necessarily coming to us after car accidents or some sort of head or neck trauma. And so when I interview these other providers on this podcast, whether it's tongue-tie specialist, airway specialist, dentist, orthodontist, the theme that I'm seeing with some of these providers is that they also ask the question why, and what that led them to was this understanding that the facial structure, the upper palate, the jawbone, the tongue, how the tongue moves, how we swallow, how we're breathing, how well we sleep, all of this has sort of a connection and a tie to how we develop. Okay, so this is the second spoke in the framework, is looking at developmentally how our body was able to develop, and if there were things in our development that were barriers for us that led to neck tension, that led to our tongue not being able to move properly, that led to us swallowing and sort of compensating and adding all of these extra muscle groups. Sleeping being improper, we breathe through our mouth too much. Maybe we have sleep apnea. Maybe we're thrusting our jaw forward at night and our teeth are grinding down. And so what we're finding is a lot of people have these barriers. So they have the neck problem, but we understand that, okay, the problem is largely impacted by these developmental barriers. And so when we find these things, we evaluate them. It's not as if everyone has to, have their tongue move perfectly and restore how they swallow and breathe through their nose all the time in order to feel better. We actually have lots of patients that we're able to get them near complete relief. But then we talk about, okay, there are these other things when you think of your overarching health that we encourage you to pursue treatment for, so that you don't have a higher level of tension running through your shoulders and your neck. Sometimes these are the people that say, like, I just feel so tight all the time and I don't know why, okay? There may be a reason why, and we want to find that and provide a solution. So what is the solution in this spoke of the framework? It's to find a provider, most of the time as an airway specialist, tongue-tie specialist. This could be myofunctional therapy, someone to restore the ability for your neck, jaw, shoulders to move the way they should, okay? So the first spoke is evaluating and understanding how to treat movement in the upper part of the neck, jaw, shoulders. And then the second spoke is making sure we screen and know how to evaluate for any barriers that that person may have in moving. Okay. And then the third spoke, this final spoke, is looking at the systemic side of pain in the body. Every individual will have a slightly different threshold for what their body can tolerate as far as a pain threshold. And so this is where things like gut health, hormone health, even like stress and the environmental side of life, the things that you put your body through on a daily basis that impact all aspects of your body. How much stress is your body going through on a regular basis? And is that impacting your ability to even tolerate what's happening in your neck? You see, if someone has poor gut health and their gut isn't able to absorb the nutrients their body needs, or maybe their diet isn't what it should be, and they have a higher level of inflammation just running through their system, and their neck has a problem, their body's going to be much more sensitive to what is happening in their neck because they already had a resting heightened level of inflammation. Hormones are definitely a factor here too. So if there's irregular, imbalanced hormones, that can have an impact on pain thresholds. And then stress levels as well can manifest as increased muscle tension and then also impact the body's threshold for tolerating pain. We think of like the fight or flight response, rest and digest, the autonomic nervous system. That is also falling into this category. So this category is looking at overall health and how someone's body is able to tolerate the pain that is generated from neck, jaw, shoulders. And in this category, if we're going to provide a solution, it's going to be a lot of lifestyle stuff. So we can coach people on lifestyle changes. To get more in depth, it would look like functional medicine, potentially naturopathic medicine, maybe even health coaching, things like that, a dietitian. And so it's the things that are taking steps towards general health in ways that you wouldn't necessarily connect to headaches. I mean, actually, maybe I'll take that back because it's probably more common for people to think, how do I improve my diet? Am I allergic to foods, or is there a food that's triggering this? It's probably more common to think about that than people are to think, oh, I have a neck problem and I need my neck treated. I don't think that's because of like what people experience. I think a lot of people experience neck pain. I think that's just how our healthcare views it and educates. It's more reasonable to think you should go down a diet than it is to improve physically what your neck experiences on a daily basis. Okay, so that's the 3-spoke framework. Okay, now this is a framework that we feel very confident in. This is a framework that we feel we can basically address nearly any type of headache or migraine, and especially if you've gone through our healthcare system, haven't found answers, and have had all the testing, imaging, tried all the meds, nothing's helped. This is a framework that we use that solves even the toughest cases. And so what I want you to take away from this podcast and this framework is understanding that for each of these, generally everyone that has a headache or migraine, this will be true. Each spoke of this framework will have some role to play in your story. Okay, you don't have to you don't have to do all three. You don't have to do all three. We encourage most people to pursue, understand, and potentially adopt elements of all three. The first element, the source of the pain itself, I would argue is one of the most important, because if we don't address the source of the pain itself, I mean, we can remove developmental barriers. We can release tongue ties, and we can restore how the tongue functions and things like that, and that can help a ton. Your neck doesn't necessarily just start moving the way it should, though. It needs to be restored, and we've seen that plenty with people that go through a tongue tie release but still need their neck worked on. And then if you have your gut health restored, you see a functional medicine doc, you get your hormones balanced, the underlying source of pain, like you might be able to cope with that source of pain much better. So you'll probably see a positive result, a benefit to your situation, but the symptoms will still pop up. And so you can take pieces and elements of this, but it's important to know that if you have some relief in one, it doesn't mean you can ignore the others, okay? And so I want you to use this as hopefully there's light bulbs going off here of like, oh, I've been really separating these and for the sake of finding the thing that's the problem, but we have to use all three buckets, all three spokes in the framework if we're really going to find the most long-lasting, holistic, getting to the source of the problem. If we're going to actually solve this thing, we need to think in this way. All right, so that's our framework. I'm actually working on a book that I can't put a time frame on it, but I'm putting this information in a written format so that we can get this into people's hands and again, continue to further this journey and helping people. Thank you all so much for listening every week to the Headache Doctor podcast as I continue on this journey of educating and empowering everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.